ethics. What are ethics? Home health aides face challenging decisions and dilemmas every day. But what tells us what the right and wrong decisions are? Ethics. Ethics are the concepts and principles that guide your behavior and decisions. Ethos is the root word for ethics, which means custom, habit, character, or disposition. Ethics are rooted in the values and beliefs of the society you are in and help to protect the rights of people and govern people's behaviors. Ethics and the law are often closely aligned. But ethics and laws are not the same thing. Ethics tells us what we should do, and laws tell us what we must do. Laws are based on ethics and are established by governments to help people live together peacefully. But ethics and laws are important when providing healthcare. They protect both the patient receiving care and the people providing the care. Why should you learn about ethics? You must be alert to any situation that might harm the client or the public and report it immediately. Ethical dilemmas do not always have a single right choice. While working with clients, the home health aide must be able to identify and respond to ethical dilemmas. The longer an individual remains in the field, the more ethical dilemmas they are likely to face. What are ethics in healthcare? Ethics in healthcare are statements of what is right and wrong. They're a system of moral principles, and they're what's best for society and individuals in that society. They are a moral philosophy. In order to make the best decisions, some considerations are used. These considerations can be identifying what the patient views as unacceptable and what they perceive as good quality of life. Analyzing the benefits and risks of each reasonable intervention. Analyzing the risk of an intervention and the potential suffering it might cause. With or without treatment, what is the prognosis or the likely outcome? In healthcare ethics, guiding principles are applied to medical and health decisions. It is a multidisciplinary approach, meaning it uses people from many different backgrounds to make recommendations on the course of action. Many times, home health agencies make their own rules and enforce their values through what is known as a mission statement. What are guiding principles? Healthcare or medical ethics are rooted in 4 principles of bioethics: autonomy, beneficence, non-maleficence, and justice. Autonomy is the client's right to decide what is done to his or her body. It can be the decision to receive treatment for an illness, the decision to receive health care at home, the decision who will be providing the care, and the decision about when the care will occur within reason. When receiving home care, the patient should be able to make decisions about their own care. Home health care workers should notify their agency or employer if there's any conflict based on the patient's beliefs or values. Beneficence means doing the best you can for your clients. This involves arriving on time, being kind and caring, making sure your skills are up to date, and participating in training to improve your skills. Non-maleficence means not causing harm to your patients. It involves making sure you're trained to perform a procedure, making sure you are allowed to perform a procedure. Is it in your scope of practice? Be aware of risk management, safety procedures, and protocols. Be aware of best practices and any updates to best practices. Changing your practice when updates are made, not just doing it the way you always have. And understand protocols to cause less harm to the client and less liability issues for the agency. Justice is the idea that medical decisions should be fair and just. This means that health workers are not allowed to discriminate based on race, age, religion, gender, sexual orientation, national origin, or disability. Now, why are ethics important in home health care? Home health aides can make better decisions if they understand ethics and ethical decision making. Often, home health aides have to work with patients who are vulnerable, who are unable to care for themselves, who are experiencing fear or pain, and who are largely dependent on others to meet their needs. Respect for patient rights is the hallmark of the ethical home health aide. What is an ethical dilemma? Ethical dilemmas arise when a person must choose between two equally unfavorable options. Every day, new types of ethical challenges are presented in healthcare, and home health aides should be prepared to make ethical decisions. Here are some ethical dilemmas in healthcare that don't necessarily pertain to the home health aide, but something that home health aide may experience. Confidentiality. We discussed that in great detail in the last module. Organ donation and deciding who gets the organ. You might hear of or be involved in a situation where a client is needing a donated organ. Finding out that your client might be refused for this donation based on certain factors can be distressing. Access to healthcare, cost, short supplies, waiting lists. It can be very hard to hear about people that can't access the care that they need due to cost or their lack of insurance, or if there's not enough home health aides to go around. Treatment of uninsured and underinsured patients. Disclosure of medical errors. Treating clients with religious and cultural beliefs that are different than our own. End-of-life issues. Sometimes you may be involved with a client who has made the decision to withdraw care. And what that means is that they're no longer accepting treatment for their illness. So it can be very difficult to come to a peace about that and truly understand that perhaps the client does not wish it or suffer anymore from that condition. Providing care with limited resources. It is incredibly difficult and emotionally draining to provide care when you feel like you don't have enough hours in the day or you don't have enough supplies. So making the right decisions for your patient is important. Home health aides should be aware of ethical dilemmas that have legal implications and implement these practices. Always use evidence-based practices. Be aware of legal responsibilities to their clients. Provide care that meet the standards set up by their agency and that will stand up to professional review. Document completely, accurately, and in a timely manner. Here are some basic ethical guidelines for home health aides. Be honest. Never lie about the care you gave or how long it took. Protect your client's privacy. Do not accept gifts or tips. Do not become personally, romantically, or sexually involved with your clients or family members. Report abuse or suspected abuse immediately. Always follow the care plan. If you feel that the care plan needs to be changed, contact your supervisor, but don't change it on your own. Never perform a task outside of your scope of practice unless delegated to do so by the registered nurse. A healthcare ethics committee is a group of people appointed by hospitals or healthcare institutions to guide them in addressing ethical issues related to patient care. They serve as educators and advisors, but they don't make the final decision. They respect the rights and privacy of everyone involved, including the client. They provide decisions in a timely manner. Members are from diverse backgrounds with respect to perspective, expertise, and experience. They follow any policies and procedures that govern the committee. They ask for advice from professional organizations if required. If the institution is faith-based, the committee must uphold the institution's principles and make it clear to all parties that the defining principles of the institution decide what the committee will recommend. Patients have an inherent right to make informed decisions on their own, which is fundamental to respecting their autonomy. But the patient must also be deemed capable of making the decision. An individual's ability to make decisions on their own behalf is determined by their cognition, or their ability to think and understand. Sometimes capacity and competence are used interchangeably, but they're quite different. Capacity is a patient's ability to make decisions. Competence is a legal judgment as to whether that patient has the right to make decisions for themselves. Advanced care planning is when people share their values, wishes, and life goals. The advance directive sets the person's preference for any future medical decisions and care. It is a legal document that ensures the person's wishes will be followed when they can no longer make decisions for themselves. It can help to decrease the use of unsuccessful CPR, decrease futile, life-sustaining treatments and medications, meaning that those treatments and medications wouldn't work anyways, increase hospice and palliative care usage, and reduce hospitalizations.